Dr. Rummans is a consultant in the Department of Psychiatry and Psychology at Mayo Clinic in both Minnesota and Florida. You don't have blonde hair and blue ears. I guess that wasn't funny. People from up north in Minnesota understand that. Dr. Rummans received her Bachelor of Arts degree from Vanderbilt University and her MD from the University of North Carolina, Chapel Hill. She completed a residency in internal medicine and a residency in psychiatry with Mayo Graduate School of Medicine, Mayo Clinic College of Medicine, and she also completed a master's degree in medical management through the University of Texas. Go Texas. Those of you in Texas understand that. We'll talk about it later. Dr. Rummans served as chair for the Department of Psychiatry and Psychology at Mayo Clinic in Florida and vice chair for the Department of Psychiatry and Psychology at Mayo Clinic in Minnesota. She holds the academic rank of Professor of Psychiatry, Mayo Clinic College of Medicine, and was recognized with the Distinguished Clinician in 2015 and the Distinguished Professorship, the Donald C. and Lucy J. Dayton Professorship in 2016. She was elected both secretary and then president of Mayo Clinic staff, Mayo Clinic in Rochester, and served as chair of the Career and Leadership Development Committee at Mayo Clinic and was member of the Mayo Clinic Rochester Board of Governors. Outside of the Mayo Clinic, she has also served on the governing boards of the American Association of Geriatric Psychiatry, the Academy of Consultation Liaison Psychiatry, and American College of Psychiatry. Please help me welcome Dr. Terry Rummans.
Thank you so much, Jeff, and the whole group. I'm hoping that this will be something that's going to be very interactive because as all of you know, and I'm going to end up having to turn around since the slides aren't up there and they'll be back behind me, so if I'm constantly doing this, you'll know why. But as all of you know, this topic is changing day by day, and it's changed dramatically over the last year. So I would like to hear questions and input from you as we go along. So don't hesitate to stop me for any reason. This is a small enough group here that I hope we will have a good discussion. So what I want to talk about a little bit today is the impact of COVID on mental illness and substance abuse. So this is where I'll kind of turn around sideways a little bit for you. The mental health and substance abuse has increased over the last several years to 1 in 3 people. That means that every single person in this room is impacted either by mental illness or substance abuse. It's either you yourself, one of your family members, or a close friend. No one is immune. People like to stick their head in the sand and act like, oh, not me, not my family, not my friends. Oftentimes that's just because they have the people who are suffering aren't sharing that data with you and letting you know because they feel like they can't. So this affects us all. Even in 2013, we're talking years ago, 8 years ago, when you looked at the cost of mental health and substance abuse combined, it cost more because of the things that I've just got listed here, the medical care, institutional care, loss of income, decreased work output, and higher problems with comorbid conditions, costs more than any other medical condition. And that includes heart disease, cancer, you name it, it costs more. But very few newspapers and basically avenues of news really talk about this very much. And since COVID, this has actually increased dramatically. We don't have the data yet on how bad it is, but we all know that this is getting worse. What about viruses in general and mental illness and substance abuse? Very little is ever talked about this as well, but since the 18th century, we've known that viruses have been associated with mental illness. Primarily, it was associated with psychotic disorders. And in fact, after the pandemic in 1918, there was a spike in schizophrenia as a result of that. But very little has been talked about, very little research has been done as a result of that, even though this was known, 100 years ago. The mechanism, as a result, because there's been no real research, the mechanism isn't totally clear. It's probably multifactorial and not just a single factor. But it could be that just because the viruses are affecting the immune system, and then subsequently it's the immune system that's causing many of the mental health issues, or it could be the virus itself that's causing epigenetic changes. Not the genetic changes that we've been studying, but true epigenetic changes. And that means genetic changes that occur because of something in the environment that an individual has. So what about COVID, which is a virus, of course, and the mental illness and substance abuse? Over the last year and a half, we've seen both direct, which are biological implications, or indirect, which are the social implications of COVID affecting mental illness and substance abuse. Those with pre-existing mental illness conditions, such as schizophrenia or severe substance abuse, are more prone to developing COVID. And we don't really even have the numbers. Many of these individuals are on the streets that I'll talk about in a few minutes. And we just don't even have an idea, and have even died on the streets that we didn't really, contribute to the COVID epidemic. But even worse, the infection that, you'd hope that a virus will be acute, but unfortunately this one is long acting for many individuals that I'll talk about in just a second. So over the next 15 minutes or so, what I'd like to do is talk about these two things. What's currently being reported about the direct and indirect implications of COVID on mental illness and substance abuse, and then what can we do moving forward? So let's talk a little bit about what do I mean by direct and indirect implications. So the direct implications, being the biological implications of COVID or this virus, is that is two-pronged. One, the virus may be actually invading the brain and affecting brain cells directly. This is starting to be shown a little bit more as time goes on, but hasn't been quite fully developed at this point. But there is data starting to come out to show that. But also, it affects the rest of the body. And it affects, when it causes inflammation, the inflammation may be in the brain, but it could be in other organs, as we already know, like the lungs. And when somebody has an inflammation in the lungs, they start getting low oxygen levels, get hypoxic, and that, of course, is going to affect the brain as well. The viruses also, as you all know, have produced what we call hypercoagulability, where the blood cells start clotting together. And these blood cells, because of that, have led to strokes that we'll talk about some more in a second. But those little tiny strokes that may be occurring that aren't totally picked up may also be causing mental illness conditions. So what about the indirect or the social implications? There are many, and I'm sure that all of you are very aware of these. A lot are changing because those are starting to open up, but as Jerry and Dave and I were talking about earlier, we're getting another spike. So we can't just assume that we're going to open up now and it's going to be open up forever. We may end up going through another period like we did last year. Time will only tell us on that one. But the isolation and loneliness contributes to depression and anxiety, loss of job and income, housing, food, just general support, and then just trauma. Trauma from your loved ones being infected or someone you know being infected and even dying from COVID. So what about the actual neuropsychiatric direct implications of COVID? I think most of you are familiar with the mild symptoms that everybody looks for when they're trying to decide whether they've been infected by COVID or some other virus. And the loss of taste and smell are extremely common, but so are headaches, dizziness, and fatigue. The more moderate symptoms, or the middle stage of COVID, is people start complaining of brain fog. They just can't concentrate, focus, and remember things like they were before. And the worst stage is the severe stage. And this is the stage oftentimes when individuals develop this are often older, or the ones that are hospitalized, and the majority of individuals that end up dying from COVID go through one of these phases, whether they become delirious, very, very confused, or they develop even psychotic symptoms as part of that delirium where they're hallucinating, delusional. We've seen people become catatonic and even manic as a result of this. Or, as I mentioned before, they start developing strokes and have a massive stroke, which would kill them. So what about the lingering symptoms of COVID that do occur? What we're finding now is probably a third of people who are kind of either asymptomatic or mild symptoms who have COVID develop lingering symptoms, which I'll talk about in a second. Half of the individuals who are hospitalized will have lingering symptoms. And what are those lingering symptoms? That are, as I mentioned on this slide, that are really, now we're starting to see it's because of actual brain changes. There's data showing that the actual brain tissue in the limbic system is a part of the brain that controls memory and emotion. And now we're getting some of the MR scans and other things that are starting to show that there's structural changes that are occurring for individuals who have these lingering symptoms. So what are the symptoms? They vary from person to person. But the common ones, people are more fatigued, they have malaise, and then this brain fog continues to linger. The interesting thing that's starting to come out now is a lot of the individuals who are under 40, everybody talks about younger people under 40, they'll either be asymptomatic or they'll just have mild symptoms. And that is true, that does occur. But what we're finding now is those individuals who are even asymptomatic, a month after they've been infected with COVID, can start developing some of these lingering symptoms. So that they start feeling more fatigued, start having the malaise, start having the brain fog. But what's worse is then it goes on to actually produce some of the mental health problems. Depression is worse, anxiety is worse, and then we'll talk about suicide in a little bit. And then the irritability. And then some research is now also showing that those lingering symptoms are helped by the vaccine. So if somebody gets COVID, they were unvaccinated, they get COVID, they're ill after the period of time where they've gone through the acute infection. If they then go and get the vaccine, some of those lingering symptoms are much improved. Not necessarily totally abated, but they do improve. So that's why it's so important, even if you've had COVID, you don't just brush it off and say, well, I've got the antibodies now, because you may start having the lingering symptoms. You want to make sure you've been vaccinated. So what about the problems that result from both direct and indirect? So there's a combination. It's not always just all biological or all social. There are a number of situations that are a combination of both. And these are the situations that are a combination of both. Depression, anxiety, fatigue, PTSD, post-traumatic stress disorder, people feeling very traumatized by what they're going on, having nightmares, flashbacks, and then just overall stress. And you can see how much it has increased just from having COVID. So what about moving on just to the indirect aspects of COVID? In 2020, so a year ago, what we learned from the emergency room group is that they were seeing a spike in individuals coming in with mental health issues. It's interesting that during last year, when everybody was locked down, the number of people coming into the emergency rooms with heart attacks and strokes dramatically decreased. And that's because people were just dying at home with them. They were afraid to come to the emergency room when they started having symptoms. And that's gone back to what's been normal. But initially that decreased. But the folks with mental health problems were coming in. Lots of suicide attempts, drug overdoses, which we'll talk about some more in a second, just stressors, violence in the home. If you've been able to escape a violent partner, or kids being abused, all sorts of horrible things actually increased in 2020 from 2019 from what the emergency room group were seeing. And what are some of the factors? And this was actually looked at more seriously through one of the studies that came out recently in one of the major psychiatric journals. And some of the things we've already talked about that you know about, social and economic factors, but what they're also finding is one of the social factors that has contributed to the problems is that loss of community and being involved in a group. And one of the most important things is a faith-based group. if they've been part of some type of church, mosque, synagogue, church formulation, or some other type of group, whether it's Rotary, whether it's some other, golfing group, some other type of community that they were a part of that gave them a sense of worth. Now they're isolated and they don't have those supports anymore. That's been a tremendous factor. And that's why people are so eager to get back to the way things were. Barriers to treatment, as it was alluded to in the little brief vignette ahead of time, there just aren't enough providers in the country to be able to provide the services that are needed right now. Medical problems being ignored that can affect mental health issues. And as everybody in this room knows, the very negative 24/7 news coverage, it is not helping depression or anxiety. And then, of course, the access to firearms that people have now. So not just suicide, but what about alcohol and drug problems that are happening? By March of 2020, so this was early on in the pandemic, they were already then seeing that the sales of alcohol had increased by 54%. Huge increase in alcohol online, as you can see from this. Since 2020, there's been 90,000 overdose deaths, which is up by 20,000 from the year before. There's a lot coming out in the news just this week, but obviously we've known this for a little while, but from the research, but it's coming out in all the news medias right now that it's up by 30% of the overdoses that are occurring. The majority of the overdoses are associated with fentanyl. Fentanyl is coming across the southern border in just truckloads, and it's being put on everything. People will come in saying, "Oh, I was only using CBD," but then you test them, drug test them, and they're positive for opioids. That stuff's being laced because there's no oversight. There's no legal federal enforcement of what is and what isn't. Marijuana, the same thing, is being laced with this stuff. Just about anything that you can think of. The other things that are coming across the border are all the stimulants. In southern Minnesota, the big drug that we're seeing coming into the emergency room almost every day with an overdose is methamphetamine. And it's horrific. We've seen people, in 35, 40 years old that we're evaluating for heart transplants because of their abuse of methamphetamine. So it's all sorts of drugs. It's not just one. So, and one of the issues with the heavy alcohol use is it affects the immune system and makes people more vulnerable to COVID, which I alluded to earlier. And then the long-term and heavy use can cause, biological changes that of course lead to dependence on this, as well as long-term medical problems. So what's the long-term potential societal impact of all of this? Let me just talk about what was going on before COVID, and then you can just multiply all of this, because we don't have the data right now to show what's really occurring societally, but we will probably in the next year. But this is what was going on even years before COVID. 46%, so it's a lot more than 46% now. They're estimating probably 60 to 70% of homeless people right now have either major mental illness or substance abuse or both problems all across the country. 21% of local jails and 20% of prison inmates have mental illness. One of the district attorneys in Miami has been a strong advocate for trying to really work to try and get more mental health resources to try and deal with minor problems that are coming up because they're being put in the jail. When all of the state psychiatric hospitals closed, there was nowhere for many of these people to go. So they went to the streets, and then they end up going to the jails. We need the hospitals back, good hospitals back. And so advocate to your representatives that this needs to happen, to have the resources to be able to treat people. And then 70% of youth that are in the juvenile detention centers right now have either a mental illness or a substance abuse problem. This is serious. And this was back in 2016. So here's the thing that was alluded to earlier, and this is why Here Tomorrow can be very helpful. But we need a lot more than just Here Tomorrow as well, because only 40% of people who are dealing with these problems get any help whatsoever. The resources just aren't there. This is another thing that's so bothersome to me, and that's why I say we need this, every state needs to be building another state psychiatric hospital again that serves both substance abuse and mental illness. What we found is the hospital beds per capita in the U.S. are lowest that they've been in 100 years. And I'll just give you some data and some problems that we've seen, especially in Minnesota. Believe it or not, Minnesota is the second worst state in the union for psychiatric beds per capita. As a result of that, we've had people sitting in our emergency room with mental health issues, believe it or not, for a month. A month sitting in the emergency room because there's nowhere for them to go. We had to open up one of our medical wings in our hospital just to put the overflow of the psychiatric patients that were coming into the emergency room. Usually it's only 1 or 2 days, but it's days, it's not hours that almost everybody's sitting in the emergency room in Minnesota waiting for a psych bed. Florida's better than Minnesota, but it's not great. So to wrap this up, to open this up to questions and comments from you folks, what about in the short term? I think many of those that are directly infected with COVID struggle with obviously the new symptoms, but also the lingering symptoms that I think everybody has to be aware of. And then many of those that are indirectly impacted struggle with ongoing social and economic problems that can lead and aggravate their depression and anxiety. In the long term, what we're seeing is the depression that develops oftentimes is much worse than before they had COVID. And we see much more anxiety that's associated with depression, biological motor symptoms that are associated, and then even worsening suicidal thoughts. Some who have not had significant neuropsychiatric symptoms with the acute COVID now maybe even seeing the development of the long-term psychiatric neurological problems weeks to months after they've been asymptomatic, as I alluded to earlier. The group that I'm the most concerned about, and I'm sure you are too, is those under the age of 12. We have no idea when young kids are being infected. We hear all about that they don't get infected or they have less problems with it. And it's true, they're not as sick, although we're seeing a rise now in young people being admitted to the emergency rooms and right on into the intensive care units with COVID. But what's worse is what's these lingering symptoms going to happen, because their brain is in that developmental stage and it's changing over time. So the impact of having a COVID virus, even though they may not have shortness of breath or get pneumonia, et cetera, we have no idea what's going to be the long-term impact. So this is really important, and this is why everybody wants to poo-poo the mask, but it really will help protect us all. One of the only good things I think about this whole COVID thing is it really has pointed at least to a lot of researchers in the mental health field that most of our mental health issues have a biological component. This is just like every other medical condition, whether it's cardiac issues, diabetes, cancer. And just think about it. If you've got diabetes, there's a social component to this. If you gain a lot of weight, your diabetes is going to get out of control. If you lose the weight, your diabetes is going to get better. Doesn't mean your diabetes goes away, just like with mental health issues, but it will get better. And it's the same thing with heart disease. If you follow the directions and use the medications that are available to you, your heart disease will improve. If you don't and do other things, it's going to get worse. Mental illness is exactly the same way, but but the stigma exists so that people are afraid or embarrassed to get the help that they need so that they can actually get better and improve. So what can be done? I mean, the first thing has to just acknowledge that this is the case, that mental illness and substance abuse are just like every other medical problem, and that every single one of us is impacted either directly or indirectly by this problem, and that we all have to work together to really try and improve the situation for all of us. Educate people about the facts. You guys know the rumor mills on everything. COVID's been, the worst. We were laughing about, chip implantation with the COVID vaccine. I mean, total ridiculous things that have come out. It's no different with mental health issues as well. All sorts of things are out there that aren't factual. You know, involve everyone you know in trying to really help with this problem. And in fact, this is a study that was just published in, as I said before, one of the major psychiatric journals that really supports some of the activities that Here Tomorrow is doing right now. And that's showing that lay people, even if you don't have a strong educational background in psychology or psychiatry or social work, that learning and working together as a group and then reaching out to those that are suffering, just by sitting and listening to them, just by connecting with people, you can make a difference. So with that, I'm going to open it up to all of you. So how about questions, comments, thoughts?
I have about 1 minute. Dr. Rummans, I thought that was amazing. Thank you. Pastor Jerry, thank you. As I'm listening to some of these questions, I'm thinking, we don't know what we don't know. But what we do know, and I read this, 5 out of 5 people have physical health. Well, 5 out of 5 people also have mental health. And as I'm listening to Dr. Rummans speak, and she's talking about a 15 to 25% rise in mental health conditions, that's concerning. So please understand, I work for, in my 30 years of professional work, I don't think I've ever worked for someone so committed and brilliant as Hannah is, probably 15 hours a day doing work that, this is not just something that we're changing in Jacksonville. We need you to help this commitment for what we're doing. But if you understood our partnership with United Way and the phone calls that we get every single day, I'm going to tell you, it comes down to self-care. It also comes down to people feeling comfortable sharing their feelings. And Pastor Jerry said something about, for the time being, we are so much more than that. Our numbers to our therapists have declined because a lot of people come to us, are walking away saying, thank you. I wish I can tell you some of the success stories every single day. But as you see this bridge here, it takes 33 days on average, or as another doctor in Jacksonville said, it takes 45 days to come and see me. Oh, it takes 30 seconds to come and see me. You just got to come in the door. And then we follow up day 1, 3, 7, 33. That's the model. We don't exercise the model. I mean, we do. We're in touch with our people almost every single day. Because if you heard the story. So what I'm trying to ask you, please, I think we've come so far, Pastor Jerry, and a few years ago we started this COVID, shut this down, and today was day 1, we're back. I need you to help us, help our community say, it's okay to not be okay. And when you talk about it, you're gonna feel so much better. Please come visit us and see what we're doing. Go on our website, heretomorrow.org. We are changing the trend in mental health care. We have an amazing board that is involved and very focused on not just saving lives, but giving people hope. And today was amazing. I thought it was incredible. Thank you, everybody, for coming. And I'm already excited to do the next one. So God bless everybody. Thank you, thank you, thank you.